wonderful new ultrasound that we use and love, is a perfect tool for this. We're going to be evaluating a bunch of different things, her heart rate and rhythm, and then what part of the heart sounds we hear the murmur during, either systolic or diastolic. And then based on that information, we're going to be imaging the chambers of the heart and evaluating whether we have valvular regurg, and if so, which valve and which ventricle that's receiving that blood, whether or not it's enlarged. So way better at ultrasounding than I am. So I'm going to kind of be her assistant today. Symphony is very sweet and well-behaved, but we need her to be really still for this. So we sedated her just a teeny tiny bit, and then the best ultrasound images happen when there's no hair through there. So I clipped a little spot on the left side. We may end up doing that on the right side as well, so we can get the best image. So my goal here isn't actually to clean, because our ultrasound is really easy to clean off. It's to eliminate the dead space created by air so that the ultrasound probe has a closer contact with what's underneath it.
So we have the lights down a little bit so Dr. Gina can see better.
I'm reaching underneath you, big girl.
Right. I'm sorry, I can go over really here. I'm not getting like a really crisp image.
So you actually take a really accurate heart rate. Love, Deb.
I can't see any of the walls really.
You got a valve right there.
Yeah.
That should be aortic or mitral?
I think aortic.
Aortic?
I'm right on the page.
Yeah. She's exerting a good bit of pressure. The equine heart is quite deep to the chest. And, oh, that's beautiful.
Can you turn it to color mode, Caitlin? Please.
So she's having to push pretty hard to get that really good deep view. Got a little bit of green.
Yeah. Quite a bit right there.
Do you think you're on mitral?
I'm facing more.
Okay. Cranially?
Yeah.
So when we're looking at this color Doppler, we want to see blue and red. The green indicates that we have backflow and mixing of blood, which commonly happens with valvular regurg. Mitral valve insufficiency is the most likely diagnosis based on the sound and the grade. And mitral valve insufficiency can have no effect on performance, but as it progresses, it can make the ventricle enlarged. And so what we're doing today is we're evaluating how large the ventricle is and also evaluating how severe the mixing of blood is. I would call that mild to moderate.
Mm-hmm.
So that helps us determine not just Symphony's quality of life, but also whether or not she can safely be a pasture pet or be ridden, and what degree of riding. And unfortunately, what's hard for us in these cases is the best way to monitor these guys are to serially ultrasound them over time. So in an owned animal, you say, hey, I'm going to schedule a farm call in 3 months, and I'm going to do a follow-up ultrasound and compare and see if we have any progression. The way Horse Plus operates, we get horses in and we adopt them out, and we're not really sure where they're going to go. So hopefully we can get Symphony to a home where she's going to have good follow-up, but we don't want to adopt horses out that are going to have major problems or require medication, or go to a home where a kid falls in love with them and then they have a shortened lifespan. So thus far, though, with what we're seeing in Symphony, I don't think that's the case with her. I think she's got good prognosis.
Okay, so they're checking on the other side of Symphony, on this side now.
Second change gain. There it is, there it is, there it is. Beautiful.
You got a really floppy valve right there.
Do you want color Doppler on?
That's definitely left-sided heart, because the right side's on the bottom right there. screen. That's right where I saw that thing flopping. Did you break a chordae? That's what it kind of looked like.
Well, I mean, valvular prolapse has like best possible prognosis. I'm not sure why. This is great. Can we always do imaging where I get to just lay on the horse? This is so comfortable. I feel very lazy. I'm just, this is like the ideal set of circumstances.
Ventricles though.
Someone else is doing your, yeah, I do see it. Left? Yeah. So let's listen on the right again. According to those designations, it is every time, but it is like, the highest I would grade that is a 3. I would say it's like 2 to 3.
So Symphony has some memory development, so Dr. Lydia is going to do a pregnancy check on her.
I know you like to think, yo. I won't sing. We all turn into our mothers, guys. It happens.
This not your first time?
So see all the peristalsis and movement. This is all GI tract. And I'm directly down. I'm over pelvic rim and I'm directly down. So reproductive tract would be laying right here, and we would be looking for a large or small fluid-filled structure. This is all GI. I don't see or feel any indications of pregnancy. Swooping over, different spot. Again, just peristalsis. Dr. Gina just finished ultrasounding Symphony's heart. I never shut up, and Dr. Gina's very quiet, but today I'm talking for her because she has laryngitis. I don't normally have an excuse for talking over other people. It's just my personality. I'm working on it. So what we determined with Symphony today, and as a qualification, neither Dr. Gina nor myself are cardiac specialists. We study cardiology in vet school. It's one class that we take. And Dr. Gina actually found a really cool CE. So before we looked at Symphony, we reviewed someone else saying the sounds out loud. So we feel pretty confident that she does have a systolic murmur that is most consistent with mitral valve regurgitation. The mitral valve, as horses age, gets weaker and basically doesn't close as crisply, so you can have some blood flow back into the ventricle. And we were able to document that flow phenomenon in the left heart from both the left and right sides of the heart. So it's a little bit confusing, but the way the heart is oriented, you can kind of see both sides of the heart from both sides via ultrasound.